Public Health England confirm first case of rare parasite-borne disease in urgent warning. Public Health England has issued an urgent warning for people to be tick-aware after the first case of babesiosis was diagnosed in England. Public Health England has confirmed the diagnosis of a case of babesiosis and a probable case of tick-borne encephalitis in England. It is the first record of a UK-acquired case of babesiosis and the second case of TB being acquired in the UK. Both are rare infections spread by the bite from an infected tick. Both patients have been transferred to hospital, where they are receiving appropriate treatment. Babesiosis is caused by a parasite which infects red blood cells. Meanwhile, TB is a viral infection that affects the central nervous system. Public Health England has said it has been working to understand the potential risks of tick-borne infections in England. They added this year they have surveyed sites in Devon close to where the person with babesiosis lives, collecting and testing hundreds of ticks, all tested negative for the parasite which causes babesiosis. FE has also tested deer blood samples from Hampshire in areas near to where the person with probable TB lives. They found the samples have shown evidence of likely TB virus infection, which matches similar results found in 2019. Dr. Catherine Russell, consultant in the Emerging Infections and Zoonoses team at FE, said, "It is important to emphasize that cases of babesiosis and TB in England are rare and the risk of being infected remains very low. Lyme disease remains the most common tick-borne infection in England. Ticks are most active between spring and autumn, so it is sensible to take some precautions to avoid being bitten when enjoying the outdoors. Seek medical advice if you start to feel unwell after a tick bite. Those with babesiosis will have either no symptoms or mild symptoms of infection. But people with weakened immune systems can become very ill and present with flu-like symptoms such as fever, chills, muscle ache, fatigue, and jaundice." Health Secretary Matt Hancock tweeted, "We're constantly looking at the latest data on the spread of coronavirus, and unfortunately we've seen an increasing rate of transmission in parts of northern England. We've been working with local leaders across the region, and today I chaired a meeting of the Local Action Gold Committee. Based on the data, we decided that in Greater Manchester, parts of West Yorkshire and East Lancashire we need to take immediate action to keep people safe. The spread is largely due to households meeting and not abiding to social distancing. So from midnight tonight, people from different households will not be allowed to meet each other indoors in these areas. We take this action with a heavy heart, but we can see increasing rates of COVID across Europe and are determined to do whatever is necessary to keep people safe."